This case was filed by the estate of Andrea Tellez Rojas by her personal representative, Yadira Tellez Rojas. We call her the plaintiff. The case was filed against the Hillsborough Pediatric Clinic, who we call the defendant. First, you're going to hear our opening, my lawyer's openings, and then you're going to hear the defense opening, and then we'll get into the first day of the expert witnesses. And I won't show all of it just because, again, it was a 2-week trial, and it was every day, all day, I mean. And so that was a very lengthy trial. So the first one, it introduces the video of Andrea.
We also have a video that was taken of Andrea. It's about a 30-second video clip that was taken about a year before she passed away. This was at her sister's graduation. She's wearing her sister's cap. She's asked by a cousin, "Hey, Andrea, what do you want to do with your life?" And again, this is the evidence that we have. There has to be some measuring stick for loss or incapacity, and this was Andrea's answer.
Say it.
I'm going to come to OSU.
And what?
And major in engineering.
Okay. What kind of? There's so many.
Bio.
Oh, there is bioengineering. Very good. Okay. What's your name? What year is it? What's the date?
It's June 14, 2019.
Okay, fine. Bye.
She wanted to be a bioengineer. And what you would hear from her sisters is that she was part of the robotics club. She loved math. She liked doing math problems for fun. And you can use that evidence when you make your decision about what she likely would have done with her life.
The next part that we present the plaintiff, we do address the audit trail, and how that is very important to note that the changes were made after the fact that they knew that Andrea died.
Now, what's important about this case, after Andrea died, the morning after she died, what we see when we look at Ms. Moss's chart is that she added information to Andrea's chart at 10:19 a.m., the day after Andrea died. She wrote in Andrea's chart this entire planned comment about what occurred at that visit. And what's important is that she says she discussed with the family labs versus going to the ED. Andrea's mother testified and will testify that Ms. Moss never talked about taking Andrea to the emergency department. The only plan was to take her to the lab, and we'll call you with the results. This information was added to Andrea's chart after Ms. Moss knew that Andrea passed away the night before. Now, how do we know that? Well, we got a copy of what's called an audit trail. After filing this lawsuit, an audit trail, all the hospitals and doctors and clinics, they use electronic medical records now. And there's an audit trail associated with who did what, when. So we can see from an audit trail who entered information in a chart, what information they entered, and when they entered the information. And what we found is, it's difficult to read, but Exhibit 11, page 92, you'll have the entire audit trail. The right column, this is what was charted on August 12th, after Ms. Moss saw Andrea. All of this information here, including Ms. Moss's claim that she discussed taking Andrea to the ER with her mother, was added at 10:19 a.m. after she found out that Andrea died. Now, we don't know her motive for adding this information, but this is a trial. A fair inference can be made. This information was added because she found out that Andrea had passed away. And we can see up here the time. The user was Kelsey Jo Moss, 8/13/2020 at 10:19 a.m.
Okay. So next goes Jeff Young. And yeah.
That's the idea that Ms. Moss altered her chart notes the next day. What you will hear in this case, and the evidence will show, that it is a typical routine pattern practice for healthcare providers to do their notes the next day, sometimes even a week later. What you will learn is that when providers like Ms. Moss are in the room with their patients, they want to be face-to-face with them. They want to look at them. They want to engage with them. They want to ask questions, actively listen to what they say and how they say it. They can't do that when they're staring at a computer screen typing away. That's why they do their notes after the visit. The other thing you'll hear from Ms. Moss is that she didn't change her note. She finished it the next day, just like she always does in her practice. She has appointments and patient visits almost every other day of the week. Thursday is her non-clinic day. And on her non-clinic day, she logs into her computer. She completes her chart notes from the prior week's visits. That's always been her habit in practice. She wanted to complete her note so that it would be accurate and thorough. She never thought that her note would end up on a big screen in a trial, or that there would ever be a lawsuit. There was nothing sinister or insidious about it. I mention this because it'll be important for you to remember that the criticisms that are being made about Ms. Moss's care are being made in hindsight, with the benefit of retrospect, knowing what the outcome would be. That's not the standard, and that's not what Ms. Moss knew what would happen. The standard for healthcare professionals, which you saw on the slide put up by counsel, is that healthcare professionals are judged based on the information they had at the time. It's not based on retrospect. It's not based on hindsight. And so through the course of this trial, I think it's important for you all to remember that. Now, as you heard during jury selection, the plaintiff goes first. They present their evidence and their witnesses. And you won't hear it from any of Ms. Moss's witnesses or evidence until probably the end of this week. And as you hear the evidence through the course of the next couple of days, I ask you to keep an open mind. That you not make any decisions until you hear all of it in the course of this trial. What we believe the evidence will show you is that Ms. Moss met the standard of care, that her actions based on what was in front of her at the time were reasonable and appropriate, that she was well trained, she was dedicated, that she wasn't any less dedicated in this visit than she was in any of the other 1,000 or so patients that she had seen prior to this time. She listened to Ms. Tejas-Rojas. She examined her. She asked her questions. She laid out a clear plan for her care. She was careful. She took her time. She evaluated whether Ms. Tejas-Rojas needed to go to a hospital or if she could be followed up as an outpatient. She applied all of her education, experience, and training to the entire visit. She used her judgment to formulate a plan which she explained to Ms. Tejas-Rojas and her mother. She didn't just send them home to get supportive care, to get rest and drink fluids. She wanted more information. She ordered 10 different lab tests. She consulted with her colleagues. She planned to follow up once the lab tests were done. It would be wrong to characterize her as anything other than careful, skillful, and diligent. You will hear testimony from highly trained providers with extensive experience in pediatrics who will explain to you that Ms. Moss met the standard of care. The evidence will also show that Ms. Tejas-Rojas did not have any signs or symptoms that suggest that she was at imminent risk of decline. She was active and engaged. She was capable. You'll hear that she was intelligent. She was well-spoken. She gave a thorough and detailed history of her symptoms. She was not in distress. She was stable. Her symptoms were indicative of a viral illness, but because she was back, second time in the clinic, Ms. Moss wanted to do more follow-up. Again, there wasn't anything to suggest that her condition suddenly declined, or that she needed to be sent to the emergency department. Based on what Ms. Moss saw and heard and found, she determined that Ms. Tejas-Rojas' condition was stable, that she could order more testing, that she could follow up with her as an outpatient.
I'll later talk about why some of those are not true, but that'll be in one of my last videos.
You've already heard at the end of the visit, Ms. Moss talked to Andrea and Mrs. Osorio and talked to them about going to the lab at Tuolumne Hospital before they closed so they could get the blood drawn. She told them they should go to the emergency room if the symptoms got worse because that was something that she always tells her patients. You'll learn that Ms. Moss's standard habit and practice, her routine, her training, is to tell every patient who's there for a sick visit to go to the emergency room if they get worse, if they don't get better. Because that's what she learned in her training. That's what she teaches her graduate nursing students, and that's something that's ingrained in her practice. You'll hear that Ms. Moss gave instructions to Mrs. Osorio in English and in Spanish, and that there was no indication that it was not understood what was discussed in the visit. You'll hear that Mrs. Osorio knew that Hillsborough Pediatric Clinic had interpreters available if she felt one was necessary, but she also didn't feel that one was needed because she understood the plan and she knew where to go. After the visit, they went to get the blood drawn, they went to the pharmacy for the prescription, and then they went home. And while Andrea was at home, there was a sudden change, and that's when the family decided to take her to the emergency room.
So just think about sitting in that courtroom, not being able to say anything, not be able to just say how untrue a lot of those were. But again, this is why I'm making this video. I think about how powerless I felt in that courtroom, just listening to all of them. You know, they've been doing this for many years, and yeah, like I just felt powerless.
1 p.m. Brenda and Ms. Diaz Rojas went to the Randall Children's Urgent Care Clinic on Cornell, and they saw a pediatric nurse practitioner named Tammy Winchell. Ms. Winchell's note stated that Ms. Diaz Rojas had a sore throat and a headache. She took vitals, they were normal. She had normal pulse, no fever, her respirations were normal. She had good oxygenation. Ms. Winchell didn't take a blood pressure, but you'll hear that blood pressures are often not taken for visits like this when someone comes in with an illness.
So that was another thing that I was upset about, because in their trial, they're going to keep bringing up how Terry Winchell and an RN who was rooming patients didn't check blood pressure. They're going to keep saying that's also why it wasn't standard of care. So the first witness that we have is a children's cardiologist. His name is Dr. Chang, and he's basically going to talk about, you know, why a blood pressure was needed and how it was standard of care.
Talk about the first trajectory, that she may have never even gone into cardiac arrest at 8:30 with that supportive care.
Correct.
The second trajectory is, if she had gone into cardiac arrest at 8:30 anyway, even with the supportive care, had she already been in the ER, what would that have looked like?
Well, they would be doing CPR and transport her to a facility where they could do ECMO or a mechanical support device.
And what is the likelihood of Andrea's survival had she been admitted to the emergency department no later than 5 p.m.?
I think 80 to 90%.
Now, counsel for the clinic suggested that Andrea's death was essentially unpreventable. Do you agree or disagree, and why?
No, I disagree. I think, of course, death of any child is very tragic, but I think it's doubly tragic when the entire sequence could have been handled and managed very differently, and this entire situation, including her death, was preventable.
Counsel also suggested that lymphocytic myocarditis is rare. Does that excuse a provider from meeting the standard of care?
No, I think anything, it's even more important that we maintain a standard of care, because those cases are, again, not rare, because it's vastly underdiagnosed. But when it does happen, we need to be practicing at the standard of care or better.
And even if it's rare or difficult to diagnose, if Andrea had supportive care, that would have extended the amount of time to make a correct diagnosis. Is that right?
That's correct.
Medical records that you reviewed of Andrea Tellez Rojas.
Yes.
You reviewed all the Hillsborough Pediatric Clinic records.
Yes.
And you reviewed all of the lab results from August 12th, 2020.
Yes.
Did you review the emergency department records?
Yes.
And what is your opinion on whether Andrea likely would have survived if Ms. Moss had sent her to the emergency department that afternoon?
I think overwhelmingly the chances that she would have survived.
And can you assign a probability to that chance?
I think 89% minimum.
So you think Andrea would have had an 80 to 90% chance of survival if she were admitted to the ER that afternoon?
That's correct.
All right. And what is the basis for your opinion and analysis?
Well, I think she would have been put on a monitor, and the heart rate and the blood pressure would have been low, because the blood pressure was never taken in the clinic. So the blood pressure would have been low by then. And the heart rate is sometimes unreliable at this stage in the disease, but certainly the blood pressure would have been very low.
So you're saying that the vital signs that were measured and recorded were not complete. Is that correct?
Correct, because there was no blood pressure taken that I can recall, but the respiratory rate was elevated for age at 24. And as I said, heart rate can be unreliable in this disease at this stage. The only thing that was reliable was the pulse oximeter reading, which was, I think, 97 or 98 at the time.
So they did get a blood pressure and a heart rate at the hospital when she was coding. Her heart came back for a little bit. I just remember that part. So now it's Jeff Young's turn to ask Dr. Chang some questions.
And where you work, Children's Hospital of Orange County, that's a tertiary referral center, right?
That would be correct, but we also have an emergency room.
Great, okay. I didn't ask about that, but that's okay. And at Children's Hospital of Orange County, that's a referral center for patients who are being referred to you for suspicion of myocarditis, right?
Well, that's partly correct. As I said, it's important for you to realize that we do have an emergency room and we do have outlying clinics, because that will be the same scenario as it happened with Andrea, that there wouldn't be a cardiologist on standby overlooking everything. I would still be getting the referral as if it was a standalone clinic.
So if an EKG had been done, and if aspirates had revealed the presence of a viral illness, that is still a broad differential that is not confirmatory for myocarditis, right?
Well, it depends on what the EKG is showing. If the EKG is showing fast heart rate and the EKG is showing some changes that would be consistent with myocarditis, then certainly the diagnoses would be narrowing to most likely myocarditis.
You'd agree that early myocarditis symptoms can look just like flu symptoms, right? I believe you testified to that.
Well, as I said, they're not mutually exclusive diagnoses. You can easily have both, and perhaps that's a major takeaway for all of us, is that you don't have just myocarditis or flu. You can have both.
Okay. And you indicated that the survival rate with ECMO is 90%. Is that right?
Yes.
Is that reported in the literature, that number?
Yes, it is.
Did you check the ELSO database before coming in today for what the survival rate would have been with ECMO in 2020?
Remember, we have to be clear on the numerator and denominator. So the ELSO registry, which is a registry of all the kids that have been on this ECMO device, are the sickest by definition. Lots of children would not even be referred for mechanical support. So your data is looking at the sickest of the sickest patients who went on ECMO. Of course, the survival off of ECMO would not be as high as everybody. So you're not including everybody that came in with the diagnosis of myocarditis.
You agree that the ELSO is a global and national registry of patients with myocarditis who undergo ECMO treatment, and it's a reported database of survival rates and outcomes, right?
Off of the mechanical support population. Okay. Again, so just so we all understand, so let's say you have 100 patients with children with myocarditis, and let's say 20% go on ECMO. So 80%, the ELSO registry would not have much information on because it never entered your database. So of the 20 children that went on ECMO, perhaps 10 or 15 will survive, but the others wouldn't. So you can't say, well, the survival of the entire population is only 15 or 20% because you're not looking at 80% of the population.
You indicated earlier, and I believe I heard you correctly, that pediatric myocarditis is vastly underdiagnosed. Is that right?
Right.
And I believe you indicated that in order to make the diagnosis, you need to be above the standard of care. Is that right?
No.
Vastly above?
No, what I said was, in this case, the care was below standard of care because there was no blood pressure taken. The respiratory rate of 24 was recorded, but nothing was done about it in terms of getting a chest x-ray and some further assessment. And then the laboratory tests were grossly abnormal. They were the kinds of abnormal lab values that would make you want to get the patient in the emergency room immediately. And so I thought those were below standard care. And even if it's 1 in a million, it's not a convenient rationalization to say, well, it's 1 in a million, so we don't need to achieve standard of care. I think that's all the more reason to achieve standard of care.
Let's talk about the lab tests. You're referring to the creatine kinase, is that right?
The CK, that's correct.
CK, and that's just a general inflammatory marker, is that right?
Well, it's a general inflammatory marker, but it's also very well known, even with some lay people, because I get calls about this, for heart-related issues, specifically a heart attack or a heart problem.
But it's not specific for myocarditis, right?
Well, again, you're using the word specific very loosely, and I'm a biostatistician, so when I say specific, I mean that it's good enough to really raise awareness that this could be the disease, which is the case of the CK, and that's like 5 to 10 times higher than normal.
Creatine kinase just is indicative of inflammation, general inflammation, right?
Well, it's indicative of general inflammation, that's correct, but it's also indicative of a heart problem. And when adults have heart attacks, that's one of the lab tests I get is a CK, particularly the MB section of the CK, which is a type of CK.
But you have no idea whether or not CKMB was available at Tuolumne Hospital, true?
No, and it wasn't necessary because I think the index of suspicion has to be low for anyone that's sick. When the lab value is that abnormal, you can't say, well, it's just generalized inflammation or just a cold, because if it's something else, like sepsis, which is a life-threatening bacterial infection, it could have been sepsis. But I was surprised that the lab was ordered, but there was no sense of urgency to make sure that they know what it is. And if it's serious, to get the patient into the emergency room, which would have given her an extra 3 or 4 hours that would have saved her life.
Haven't you given testimony in other cases that creatine kinase is not specific for myocarditis?
Well, I never said it's specific for myocarditis. I said it could be very indicative of a heart issue, including a heart attack. Child with myocarditis, you cannot rely on just listening to the heart to get the real heart rate, because the heart is sufficiently weak that it doesn't generate enough sound on every single heartbeat. And that's why a child like this really needs to be on a monitor, so we can really see what the electrical activity is, not just the pumping activity. So it depends on the methodology that you're getting the heart rate.
I understand that's your testimony, but the number itself is documented as normal. Yes?
The number that was put down with a faulty methodology is in the normal range.
Yeah, they try to use the chart note as facts. And again, questioning, since the beginning, the, accuracy of the charts, of the notes. Because it's all so CYA, like just so thorough, but we have templates. And that's what something in my deposition that they were trying to say. How do you know that they have depositions? And then that they have templates. And I was like, who doesn't have templates, I've witnessed people when they chart something, it came from a template, and it's like, in my experience, there have been events where I'm like, I don't remember you asking that, or I don't remember, so it's very possible,
Normal oxygenation, 97%. You're not taking issue with that number as being abnormal, are you?
No, only in the context that the respiratory rate was abnormal. So you can always breathe fast and maintain oxygen level. So you can't just take one vital sign, as much as I know medical legally you like to. You cannot just take one number and say this is normal or abnormal.
Do you know the method by which the oxygenation was measured and obtained at the Hillsborough Pediatric Clinic in this visit?
I believe it was by pulse oximetry.
Okay. Isn't that the fingertip device?
Yes.
Okay. Isn't it true that device also tells you what the heart rate is?
Yes.
Okay. And can we agree that if there was indication that the heart rate was abnormal using that device, that this number would have been adjusted accordingly?
No, because the way the pulse oximeter works it also depends on how forceful the heartbeat is, how hard the heart is contracting. So you can pick up every other beat if the heart is weak enough. And that's why, as I said several times now, the only reliable way you really know how the heart is beating in terms of number of times per minute is by connecting the patient to a monitor. Or indirectly, you can look at an echocardiogram, you can then see how the heart's beating. But short of those things, the traditional methodologies fall apart. You cannot rely on pulse ox, you cannot rely on blood pressure, you cannot rely on listening, because every other heartbeat might be weak enough that you don't really hear a sound. So you have to connect the patient to a monitor.
Isn't it your experience that most outpatient pediatric clinics do not have echocardiograms in their clinic?
That's correct.
Okay. And in fact, in order to get an echocardiogram, a patient would have to go to the hospital, right?
Correct, but most clinics have EKG machines.
Okay. Do you have any knowledge
Or monitors. Or monitors.
Do you have any knowledge or understanding as to whether or not those devices were even available at Hillsborough Pediatric Clinic?
I do not, but most or all clinics I know of would have at least some sort of monitoring device.
The respiratory rate of 25, that's within the normal range for age adjusted at the age of 14 for a pediatric patient, right?
No, the respiratory rate recorded was 24, and that would not be considered normal.
Okay.
The normal range is 12 to 15.
You would agree that there were no clinical signs of respiratory distress found by Ms. Moss on exam, right?
Well, by what was documented by the practitioner, but the rate alone would make me very suspicious something isn't right.
You would agree that there are no clinical signs of a low blood pressure based on what Ms. Moss found during the exam, right?
Well, oftentimes there are no very obvious clinical signs of low blood pressure, just low blood pressure.
Let's talk about some of those clinical signs. Her skin was warm, right? Well perfused. That was what Ms. Moss found.
Yes, that can be the case in low blood pressure.
Normal capillary refill where she pressed on the cuticles and watched the rate in which the blood flow would return to the fingertips, that was normal, right?
Correct.
Okay. Because she was not having labored breathing or stridor or rales or anything like that, that's also indicative of her getting good blood flow and good circulation, right?
No, we're not. I think a simple blood pressure that's not normal would trump everything that you've mentioned.
Isn't it true that the blood pressure is usually the last vital sign to go when somebody's in shock?
It's one of the last signs, but it doesn't have to be the absolute last sign.
But more often than not, it is the last one, right?
Sometimes it is, sometimes it isn't.
And it's possible then that given Ms. Diaz-Rojas's presentation and sudden change just before she went to the emergency room, that her blood pressure might have been normal if it had been taken during the visit with Ms. Moss.
I think it's highly unlikely that a patient who had several episodes of being unresponsive and actually got CPR for resuscitation in the emergency room had perfectly normal blood pressure just a few hours before. It's physiologically not possible.
Yeah, so Jeff keeps saying, like, it's a fact, like, that the blood pressure would likely be normal. And in my deposition, I remember when I was trying to say standard of care, or, you know, things like back with the template, him and Aaron would just constantly be like, how are you sure? How can you be sure? Well, maybe at this clinic, but not at this clinic. So it's just really interesting how, you know, it's flipped now that he's stating it, you know, that, oh, the blood pressure would have been normal. And it's like, you don't know that. You don't know that. Yes, kids over, you know, they can compensate better than adults, but at this point, not taking the blood pressure, you know, you can't 100% be sure that it would have been normal, because I doubt it would have been the way my sisters and my mom described Andrea. And then at some point we have other witnesses with how she looked, you know, and yeah, so all of this is just frustrating to hear again.
You're aware there's no claim against Ms. Moss for failing to diagnose myocarditis, right? That's not a claim in this lawsuit.
For the myocarditis, but for falling below standard of care and not getting a blood pressure, I think that's not acceptable.
You're aware that in terms of myocarditis, it can have a variable presentation, right?
Yes, of course.
It can range from subclinical, meaning presentations where there's no symptoms at all of myocarditis.
Correct, but that's not the case here.
And it can also present with sudden and acute heart failure, right?
That doesn't exist. Sudden acute heart arrhythmia, yes, they can certainly have that, but not sudden acute heart failure within a few hours, no.
Is it true that pediatric myocarditis is one of the leading causes of sudden death in pediatric patients?
It's one of the causes, yes.
You're aware that there can be situations where the myocarditis presents without any symptoms or just very subtle symptoms?
That's correct.
You agree that myocarditis in an outpatient pediatric clinic setting is a very difficult diagnosis?
No, I disagree with that. I think, again, there's no claim for the diagnosis of myocarditis. I think if you don't get a blood pressure in a pediatric patient that has been sick for 10 or 12 days, and I think that's well below standard of care, because the blood pressure would not have been normal.
Based on the testimony of Ms. Diaz-Rojas's family, who was at home in the period of time between 5 and 8 o'clock, there's at least a few hours where she did not appear to be in shock, right?
Well, she did not become unresponsive, which would be a clinical indication someone's low blood pressures to the point where they pass out.
You remember seeing the testimony based on what they described, that there was a sudden and acute change while she was at home with her family?
Correct.
And do you remember seeing the testimony of her sister, Yadira Tejas-Rojas, who was a nurse, that her sister Andrea looked ill and irritable, but did not appear to have the signs and symptoms that would be indicative of shock, right?
Well, shock is not something that you can say is there 1 minute and then not there the next minute. Well, as with any patient coming to the emergency room, she would have been placed on a monitor and had a blood pressure taken. Those are the minimum things that happen when you go to the emergency room, and those would have been abnormal.
And that's an assumption on your part, right?
Well, it's based on what happened and also based on what was happening at the time of the clinic visit.
You looked at the Tuolumne Hospital ER record as part of your review as well, right?
So that was pretty much the important parts of Dr. Chang's testimony. You know, again, defense is trying to say that this was a sudden change. You know, that's what they pretty much told us. So, you know, they're going to keep saying that my mom knew that she could have asked for an interpreter. Like, they're going to need that in the future for what they're trying to prove or dismiss. But ultimately, it's not the patient's job to ask for an interpreter, even if they've had an interpreter before. That is not good customer care. You know, if you have gotten your floors done and because you had them done before and you didn't ask for some type of safety mechanism, you can't just be like, oh, well, you had the floors done before, you should have known that you could ask. You know, that it doesn't work that way. So here's my testimony, and you know, I'm going to talk about some of the stuff that I didn't talk about before that is very traumatic. And I'll be honest with you, it never gets easy just talking about the change. You know, when I saw my sister, like when I get there and seeing her pass away, I was the one that saw her take her last breath. And I pretty much have to disassociate because it's just so hard. So this is going to be about 45 minutes of my testimony, and it's very traumatic, but it has to be said.
Next witness.
Plaintiff calls Yadira Tellez Rojas.
You can raise your right hand. Under the penalty of perjury, do you solemnly swear or affirm that the testimony you're about to give in this case shall be the truth, the whole truth, and nothing but the truth?
I do.
Right, you may be seated, and for the record, please state your name and spell it.
My name is Yadira Lizbeth Tellez Rojas, YADIRA LIZBETT, and then my hyphenated last name, TELLEZ, and then ROJAS.
Thank you. You may go ahead.
Good afternoon, Ms. Tellez Rojas. We're here primarily to talk about Andrea, but I'd like the jury to know a little bit about you. How old are you?
I'm 33.
Okay, you don't need to
I'm sorry.
get up that close to the microphone.
33.
And what do you do for work?
I'm a registered nurse.
And where do you work?
Kaiser Permanente.
What kind of nurse are you?
Right now I'm in dermatology.
And describe your work duties a little bit for the jury.
Currently, because it's specialty care, I see patients for things like phototherapy or medically necessary Botox, medically necessary treatment of cryotherapy. I do some phone advice related to dermatology.
And how long have you had that position at Kaiser?
This current position at Kaiser for about 2.5 years.
Born in Oregon?
Yes.
And you are a first-generation U.S. citizen?
Yes.
Your mom and dad were born in Mexico?
Yes.
Do you have any recollection of when they came up here to Oregon?
I think my dad came in 1984 and my mom maybe 1987, roughly.
And you have a large family?
Yes.
How many sisters do you have? Family of sisters, right?
6 daughters, so five sisters, including Andrea.
Are you the oldest?
Second oldest.
And how much older are you than Andrea?
15, almost 16. She was born in December of 2006, and I would have turned 16 the following January. So about a month after.
You have a close family?
Yes.
And currently, today, you all reside in the same house in Hillsborough?
Yes.
Back in August of 2020, were you living at home?
No.
You were living outside the home?
Correct. Yes.
But today you're back at home.
Yes.
Why did you move back home?
Because we have not been the same since my sister died. So my parents, understandably so. So this is the most painful thing that I've gone through, and my dad didn't even go to the funeral. So he hasn't been the same to the point where he's had drinking problems in the past, but nowhere in this moment. Once he started, I was pretty sure I was going to lose him at some point. If it wasn't because he had to go to the hospital at some point. And my mom, she's depressed. I have a few other sisters that are depressed. So my older sister and I, we made the decision to help them financially. And my other sisters, Brenda, she wanted to go to school, so I said, "You go to." I decided to move back home so that we could try to get through a lot of this as much as possible. Not through it, but kind of help each other in this.
To get through this tragedy.
Yes.
Understandable. Do you, when you are with your sisters, do you primarily speak English or Spanish?
So with my sisters, if I'm talking to Evelyn or any of my sisters, sometimes it's English, sometimes it's Spanish. It varies with each other.
What about with your parents, or when your parents speak with you?
So the reason why we're bilingual is because we only speak Spanish to my parents. So unless it's like a slang, like a one word in English, like okay, or whatever, most of the times I'm speaking, I don't remember a time where I'm speaking English in sentences to my parents.
You said you moved back home to help support your parents, both financially and emotionally, through this tragedy.
Yes.
Correct?
Correct.
And back in August of 2020, on the day of Andrea's death on August 12th, you weren't living at home, but I'd like to go through what you were doing that day.
Okay.
You were living outside the home, right?
Yes.
And did you have to go to work that day?
Yes.
So, and you weren't living at home, so had you seen Andrea at all that day?
No.
Did you know at that time, did you have knowledge that she had been sick?
I knew that she was sick. I didn't know details as far as every day.
When did you decide that you should go back to the home on August 12th?
So, I don't remember specifically when, but I remember that I decided to go home because my sister, I don't know who it was specifically, but they kept saying, Andrea wants to talk to you, Andrea wants to talk to you. And I didn't get the phone call. I think we're not allowed to have our phones at work. And so at one point I saw a ton of calls, and I think it was at some point in the afternoon where they just kept saying, Andrea wants to talk to you, Andrea wants to see you. So at some point I decided, I haven't been home in a few weeks, I'm gonna go home and see my sister.
And then you decided to go back on August 12th?
Yes.
Did you go straight home or did you stop somewhere along the way?
No, I went to, I don't know at one point, but I wanted to stop by at Fred Meyer to see my little sister. I wanted to get a teddy bear, and I haven't seen them, so I like to cook. So I went to Fred Meyer's, which was on the, so I decided to, I was probably getting groceries, I was getting a dog, a little stuffed dog or teddy bear, and then I decided, I don't know at what point I decided that I was gonna go home.
Were you aware that she had been to Hillsborough Pediatric Clinic earlier that day?
Yes.
When you got home, did you see Andrea right away?
I might have seen a glimpse of her, but I wasn't like, hi, I didn't see her. So no, I saw her, but not maybe for a second or two. So at that point, because I was going home, my dad had wanted to go get some boots. And since I haven't been home, I decided to kind of do both. So I think I just picked up my dad and said, get in the car, we're gonna go. I decided to just kind of do all of it at once.
When you say all of it at once, you didn't go get the boots and the teddy bear?
Correct. Sometimes when my dad wants to hang out or do something, I say, yes, let's go. So if we wanted to go look at some boots for his work, I don't hesitate to okay, I'm gonna go see any member of my family.
And then you got home and you didn't talk to Andrea right away, but you eventually saw her, then what happened next?
So at some point, I remember I had groceries in my hand. It was 2 big bags, and I had a teddy bear. And I saw my little sister in the park, the car, the outside of the house. And there was Brenda and Andrea were in a car. And then I think I at some point said, oh, let me just put my groceries away. And I gave Andrea the dog at some point.
The dog was a stuffed animal.
A stuffed animal, yes. It's a bear or it's a teddy bear. I don't know if it was a dog or a bear.
Okay. So you gave it a stuffed animal. What happened next?
I think at that point I was asking, how's it going? And I'm still kind of checking and just saying hi to everybody. And Andrea is mad at me. She says, you didn't come see me earlier. And I thought that was really odd because she's never an angry person.
When you saw her, were you alarmed?
Initially, no, because I didn't look at her. So all I knew is that when she went to go see her doctor, and to me that was enough to say she's okay. I think I went at some point inside the house, and then I came back, and then at some point, once I started looking at her, then I got this thing in my stomach. Like I felt like I was gonna vomit, but I had no idea why. And then at some point, I think I go inside to go ask my mom to get information about what happened, and that's when she says that the doctor's calling her. So as she's getting a call, I'm talking to my mom, and I think that's what they were calling her for lab results. And so I think at some point I asked my mom if I could talk to her because I wanted to figure out what was going on. And I don't hear any panic or anything out of the person's voice, and so I'm still okay. I'm not really nervous at anything until I heard my sister yelling, Brenda. She said she's not doing so well, and I said I looked at her outside, and that's where that deep feeling stomach came back, and then Andrea, she just looked. So she's always like an anxious person, but she just looked different. Like she looked sick, but it wasn't until I started looking at her a little better where I think I said, we're just going to take her to the ER because at some point, once she started looking a little off at some point in the car, she didn't even talk, or she just went silent, and then we basically checked her pulse, and this gut feeling turned into this. I don't know who checked her pulse, but at some point we decided we need to do CPR. And so I think this was about a block or two away, and I decided I'm going to call 911 because I don't know what's going on, but in the moment I just decided I need to call 911. And then at some point, I don't remember how we stopped or what happened, but Brenda was with Andrea. Well, I'm calling 911 saying my sister stopped. I don't remember the verbiage, but I said, we're doing CPR on my sister. She's not breathing. She doesn't have a pulse. And then at some point, she came back, and the lady in the emergency, in the 911 says, you don't need to do CPR on someone that's talking, because she came back to us. And then at that point, it's already an emergency, so we're driving to the ER. She asked, "Do you need an ambulance, or do you need an ambulance now?" And I said, "We're already in the car. It's going to be faster if we take her."
Yeah, how far away do you live from the Tualatin ER?
At the moment, it seemed like forever. If I'm driving normally, maybe 3-4 minutes.
So you took her to, and then you arrived at the ER and had her admitted?
Yes. So we went into the emergency parking lot, and at some point we're trying to figure out. I was telling Brenda, like, tell me what's going on, like, so I can report off to the lady, because at some point I told her, I think while she was parking, there was somebody that said that there was somebody outside that wanted to screen us, and I said, the first thing I said, she doesn't have COVID. My sister, I don't know if I said fainted or passed out, but I was yelling at her saying, we need someone right now. Like, my sister is fainted and we need someone. And what I do remember at some point in the conversation was when I was talking to the nurse, I think I was talking to the nurse practitioner. She said that she was gonna call Tualatin, because I told her that we were going to take my sister to the emergency room. And so in my head, I thought they were already going to be aware. So once we get to the ER and I'm talking to this lady, Brenda is helping Andrea in a wheelchair because she couldn't walk. And I later found out that she hadn't walked in a long time. So she clearly seemed ill, and she passed out, and her heart gave out. And so I was yelling at the emergency lady. Now, once I got to registration, the same thing. I said, my sister doesn't have COVID. She passed out. We need someone right now. And to me, that seemed like forever, because I think I even yelled at one point. I said, I think they called you. They were supposed to call you that we're here. And they put us. I said that I was on the phone with someone in the clinic, and they said that they were going to call the Hillsborough Clinic. I don't remember what verbiage, but I said that they were calling, and so they didn't know any of this, and they pulled us aside to a room, and then at some point, I think what I remember was that my sister had passed out again, and then all I remember was just that there were people calling, because I was yelling like, she needs help right now, and I saw her eyes roll back, and at that point I think Brenda started CPR again, and the first responders came, and I think she came back because I was holding her hand saying, squeeze my hand, all the way through the ER. I do remember that I was just telling her, squeeze my hand. And then at some point we made it to the ER in the back. And that's when I think she finally coded again. Because I just remember she took a deep breath and then she didn't take one out. And then at that point, I knew what had happened, because they had started an IV, and then I saw them doing just chest compressions, and then at some point I think they were getting everybody in, and I was just out in the hall watching all of it, because I heard them say, like, I saw them doing, I think they did like a X-ray at the time. They were trying to call a bunch of doctors, and I was just sitting watching all of that. And then they were asking me at that point where I felt like something bad really is happening. Once it started sinking in, was when they said, "Where's your mom? We need to talk to your mom." And at that point, I don't even know. I just got there, and it was just like, it went from, I don't even know what just happened to, my sister died. So I was fine until my sister. Even reliving it right now, it doesn't seem real. Like, I'm picturing it, but to me it's not real.
Is Andrea the youngest?
Andrea is the youngest.
Can you describe what Andrea was like?
Andrea was smart. She was very, I always tell people that she was a better person than I was. So even when she was young, if I said, Andrea, like, have you done your chores? She said, yeah. She was the only one that I never lashed out at anybody, or, even me, I think I've grown as the years have gone by, as far as having more patience or being less critical of things. And in her 13 years of life, I never saw her get upset. She taught me to try to live life a little more. And so she was just the most beautiful thing that you could imagine. And so that pain of losing her is never going to go away. And, my family, we think we all, because she was the youngest one, we're almost like a mom to her. And so that's why I don't critique my parents for being the way they are, because it's the worst thing that can happen to you. And to see my parents not be okay, I don't judge them for that. I don't judge my sisters for not being okay. So that's why I decided to move home, because they're everything to me.
Do you recall what Andrea's favorite subjects were at school?
She liked math.
Did you like to, at one point, you mentioned she liked to kind of tinker with things?
Oh, yes. She, like, I think when she was maybe 5 or 6, she took the vacuum apart. And I know it's just like a screwdriver and you put things, but she liked doing that. And my dad has fixed cars before, so he never let me because he thought women shouldn't fix cars, but he let her, and I was really happy for that, because she also liked, she was in her robotics team, I believe in elementary school. And so she had told me that I think they won an award at some point, but she liked engineering stuff or just numbers, because she was always doing Moby Mac, even on her free time.
Do you want to take it?
No, it's okay. I want to keep going if that's okay.
We'll take a break within the next 15 minutes for the afternoon break.
Just for quick context, can we just name all your sisters and go from the oldest to the youngest so that we know everybody?
Mm-hmm. So Sandra, we all have the same last name. The daughters is Tellez Rojas, but Sandra's the oldest. Then it's me. I'm 33. I think she's 35. Then Brenda, 6 years later than me. She thinks she's 27, 28 now. And then Jasmine is the next one. I think she's 2 years younger than that. The older I get, the more I forget. But then Evelyn, she's 21 now. And Andrea would have been 17. She would have been entering her senior year this upcoming school year.
And as of today, everybody's back living together in the same house?
Yes, sir.
And where did you go to school?
I went to elementary school or college.
Where'd you get your nursing?
University of Portland.
I don't have any further questions.
Are you okay to keep going?
Yes, ma'am.
I only have, you're not coming in. We only have a couple questions for you. In August of 2020, who was living in your family home?
So, not me. So, August of 2020, it would have been Sandra, the oldest, Brenda, who just graduated a few months early from OSU, Jasmine was in the middle of her college, so she moved back home for the summer. Evelyn would have been 17, so she was still at home, and it would have been Jasmine, and then my mom and dad.
So your whole family lived in the house except for you?
Correct.
Okay. And in August of 2020, where were you living?
I was living in Beaverton.
And what Kaiser location did you work at?
I worked at the Beaverton location, the one by Wijimaya.
And is it correct that the first time you saw Andrea in terms of her course of illness was when you arrived to the family home the evening of August 12th?
Yes.
So you had not seen her sort of beginning the early part of August through the visit she had at
That's correct.
Sorry.
Oh, that's okay.
It's okay. So you hadn't seen her for the period of time since she started sick, when she went to Hillsborough Pediatric Clinic, the urgent care, and then went back to HPC, right?
That is correct, ma'am.
That's all my questions. Thank you. I'm very sorry for your loss.
Thank you.
Any redirect?
No redirect, Your Honor.
Okay, then you may step down. Thank you.
Obviously, I was really nervous when I had to give my testimony. Flashbacks of my deposition, and I didn't know if it was Jeff or Melissa, but my deposition was not the nicest. It was very narcissistic, like I had already said, and as much as I really appreciate my lawyers, they told me, speak your truth and answer the question being asked. So when they asked me about the nurse, where do you work and what do you do, I answered to what was I doing at that time. I was PD. So before Andrea had passed away, I was working at the, where I said I was, and I was working with kids. It depended, sometimes that would change, but I was a pediatric nurse, and I wish I would have said that because, even though I like what I do, I was very angry after what happened to Andrea, so I couldn't work with kids anymore. I couldn't do IVs, blood pressure, everything angered me. And I almost left healthcare, and that's why I had to go to specialty care. I went to addiction medicine for a few years, then I went to where I'm at now in dermatology. And so I did have background of pediatrics. Now it's Brenda's testimony, and I'm only going to be showing some of the relevance of the questions, because again, the defense is going to try to push that it was a sudden change, but that wasn't a sudden change. So
where she kind of had elevated symptoms again, nausea, vomiting, fever, and a lot of crying, and just, she was expressing how she was just feeling kind of frustrated that she wasn't getting better. And that's where I just kind of told her, like, hey, like, we have an appointment coming up, like, we don't know what's going on, but just, at least we'll continue to get some help for you, and just kind of, we're gonna see what you have, or just gonna make sure you're fine. And
When you got home, describe what happened when you got home.
When I got home, Andrea was sitting in my mom's car in the passenger seat. She was pretty flustered, just like really like anxious, and just like short of breath, and just asking to see my cousins or just going to talk to family. And I got home, and my mom was outside and my uncle was outside, and I went in the car with Andrea and I talked to her, and I saw she was anxious. I was like, hey, like, let's do some deep breathing and just kind of calm me down. And I was able to get her to calm down, but
So like you testified to, you recently graduated with your doctorate in physical therapy. Congratulations.
Thank you.
As part of that degree program, have you gone through like clinical rotations or clinical training where you're actually working with patients?
Yeah.
And through that experience and education, you'd agree that you can only treat the patient as they present to you at that time, right?
I mean, yeah, however they're presenting you is how I'm gonna treat them.
Because you don't know what might happen once they leave your space, right? Like maybe, for example, they go play basketball, and they hurt themselves, or something might change in their condition.
This is a fact witness. We're getting into expert testimony here based on our education.
Yeah, she is a fact witness. If this is leading somewhere, I'll let you do another question, but yeah, she's a fact witness, not an expert giving an opinion.
That's fine, Your Honor. I don't have any further questions.
Okay, thanks.
Really angered me because, you know, in their motions, how I wasn't allowed to testify as an expert witness because, of course, I have experience and I did show them that I was I had confidence and competent at my deposition when they were trying to really disregard my concerns. So that was one of their motions. But of course, then Melissa's trying to gaslight my sister Brenda and, you know, use her as an expert witness. So, you know, just really, again, the expertise that they have. You know, when Brenda was talking about how Andrea was crying, like that is like a knife to the heart to me because I just think about how scared this little girl was who trusted this nurse practitioner. You know, this little kid is dying and it doesn't matter at what age, you know, she is trusting this healthcare provider, and then in the lab again, right, literally right where the hospital is, like the lab is across the street. You're in the ER, and you know, and they dismiss her. And so just think of how broken she is. I later found out that Andrea had messaged some of her friends that she was gonna die. And so I think I can only imagine how like powerless she felt. She's probably thinking, I am not okay, but these healthcare providers just dismissed her because, again, she was not stable, like they keep claiming, you know, based on everything that I've heard in the aftermath. And just imagine how, you know, what are the likeliness that, you know, if not only, you know, it doesn't matter how brilliant you are, you're 13 and then, you know, you're having heart failure and you're trying to maybe explain these to the people that saw you, who you think, you know, with the respect, and so they dismiss you 2 times. And you know, what is the possibility that she's thinking, you know, it's in my head, or maybe I'm, you know, like I can just, this is what drives me to make this video and expose everyone, because there was such an injustice done to my sister. She did not die with respect. Next is my mom's deposition, and mind you, she, you know, my parents, we've been blessed that they are, you know, naturalized citizens, and you know, but she doesn't speak English. You know, I took, you know, when I took years of a language, you know, you know, like it's still one of those things where it's like I have to take more to be like fluent, but it's like just, yeah. So this is where the judge is going to say about the right to an interpreter. So, you know, they get an interpreter for my mom in the trial. I still don't understand why they didn't get an interpreter for my sister's appointment. There's just no excuse for that. It's so easy. And they have a ton of medical assistants who speak Spanish if it came down to that. I'm not, you know, But and I know for a fact that there is, certified people, at least at that time, that spoke Spanish, but in that clinic. But so listen, this is my mom's testimony.
And instruction for the jury at this point. So, ladies and gentlemen, every person has the right to have his or her testimony heard and understood. You're about to hear a witness in which an interpreter will translate for the witness. The interpreter is required to remain neutral. The interpreter is required to translate between English and Spanish accurately and impartially to the best of the interpreter's skill and judgment. You must evaluate interpreted testimony as you would any other testimony. That is, you must not give interpreted testimony any greater or lesser weight than you would if the witness had spoken English. A person might speak or understand some English without being fluent in English. That person has the right to the services of an interpreter. Therefore, you shall not give greater or lesser weight to a person's translated testimony based on your conclusions, if any, regarding the extent to which that person may speak English.
From the visit with Kelsey Jo Moss, what do you remember about the plan?
¿Usted se acuerda cuando terminó la visita con Kelsey J. Maas? ¿Usted se acuerda cuál era el plan?
Yo no recuerdo, yo nomás tan solo recuerdo que ella vomitó y la doctora recuerdo que me dijo que fuera a la farmacia, que cuál farmacia era, yo le dije que la Target, porque me iba a recetar unas pastillas para el vómito.
So I don't remember. I remember that she was vomiting, and I remember that the doctor was going to send me to the pharmacy and ask me what pharmacy I use, and I told her that Target. And she said that she was going to send a prescription for the vomit.
Ay, cuando ya salimos del laboratorio ya iba para recoger las pastillas.
And when we were leaving the lab, we were going in order to pick up the pills.
Pero como estaba muy caliente ese día, yo me paré en una sombra y yo le dije a mi hija Yasmin que fuera a ver a la farmacia por las pastillas.
But since it was really hot that day, I stood on the shadow area, and then I asked my daughter Jasmine to go and get the pills.
Y ya cuando vino Yasmin me dijo, no hay nada de medicina, no está la medicina.
So then when Jasmine came back, she told me the medicine is not there, there's no medicine.
Entonces Andrea me dijo, vámonos para la casa porque yo tengo calor, me quiero ir para la casa.
So then Andrea told me, let's go home, I'm really hot, I want to go home.
Ay, cuando llegamos a la casa, ella no se bajó del carro y me dijo que ella quería estar ahí.
So then when we arrived home, she didn't get out of the car, and she said that she wanted to stay there in the car.
Entonces me dijo que quería ver a sus primas y que si llegaban sus hermanas, pero como se fueron a trabajar y
and then she told me that she wanted to see her cousins and that she wanted to see her daughters, but they had gone to work. Sisters, I'm sorry, interpreter mistake. She told her that she wanted to see the cousins and she wanted to see the sisters, but the sisters had gone to work.
Entonces ya llegó su hermana la mayor. Y salió su tío y ya me dijo que era lo que estaba pasando.
So then the elderly sister came, and then the uncle also approached, and they were asking what was happening.
Entonces me dijo su hermana, vamos al hospital.
So then her sister told me, we're going to the hospital.
Pero Andrea no quiso ir.
But Andrea didn't want to go.
Ms. Osorio, do you remember if Kelsey Jo Moss instructed you, did she ever say the words emergency room to you?
So, lo siento, ¿usted se acuerda si en algún momento la señora Kelsey J. Moss le utilizó las palabras servicios de emergencias, emergency room?
Nunca me dijo.
She never said.
Entré en el cuarto.
I go into the room.
Estaban como 15 personas, doctores, enfermeras.
There were about like 15 people there, doctors, nurses.
Yo miré que le estaban haciendo, no sé, pero yo en ese momento le pedí a Dios que todo estuviera bien, que todo estuviera bien.
And I saw that they were doing, I don't know, and then at that point I was just asking God for everything to be okay. For everything to be okay.
Cuando ellos me dijeron, lo siento mucho, no podemos hacer nada.
When they finally told me, we're really sorry, there's nothing that we can do.
Se nos fue.
She's gone.
You can take a short break.
It's just it's like, my memory right now is like if I went back to that same day.
You want to take a break?
¿Quiere tomar un descanso?
Está bien.
It's fine.
When you left Hillsborough Pediatric Clinic, did you follow the plan as you understood it?
Usted cuando se fue de la clínica pediatra de Hillsborough, ¿usted siguió el plan como usted entendía que era el plan?
Ya no recuerdo.
I just don't remember now.
While you were at the Hillsborough Pediatric Clinic on August 12th, did you know that you could request an interpreter?
Cuando usted estaba en la clínica pediatra de Hillsborough el 12 de agosto, ¿usted sabía que usted podía solicitar un intérprete?
Sí, yo sabía, pero se me pasó y no lo pedí.
Yes, I knew, but I forgot and I didn't ask for one.
In the past, when you met with Dr. Gutierrez, there was no need for an interpreter, right?
En el pasado, cuando usted se encontraba con la doctora Gutiérrez, no había necesidad para tener un intérprete, ¿correcto? No.
And as we sit here today, again, you're confident that Ms. Kelsey Jo Moss never said the words to you, emergency room.
Objection, Your Honor. Asked and answered.
I'll allow it because we have an interpreter.
Lo voy a permitir porque tenemos un intérprete. El intérprete es una guía repetición del question.
And as we sit here today, you're confident that Ms. Kelsey Jo Moss never said the words to you, emergency room, during the August 12th visit.
Y según estamos aquí hoy, usted no recuerda que el 12 de agosto, usted está segura que el 12 de agosto del 2020, la señora Kelly J. Moss no le mencionó las palabras sala de emergencia o emergency room.
No me mencionó, estoy segura que no me mencionó.
She didn't mention that, I'm sure she didn't mention it.
You don't recall that Dr. Gutierrez spoke to Andrea in English during most of their visits together once she had reached the age of 10 or so?
¿Usted no recuerda que en la mayoría de las visitas entre Andrea y la doctora Gutiérrez que hablaban en inglés una vez que Andrea tenía como 10 años por ahí?
Pues creo que como se entendían, sí, más que no recuerdo. Ahorita no recuerdo.
I think that they understood each other, I don't remember now.
Occasionally, Dr. Gutierrez asked you to wait outside when she would see Andrea. Is that right? To see her privately?
De vez en cuando la doctora Gutiérrez pedía que usted esperara afuera para hablar con Andrea en privado. ¿Es así?
Sí.
Yes.
And Andrea was able to talk to Dr. Gutierrez about how she felt and what she needed?
Y así Andrea podía hablar con la doctora Gutiérrez acerca de cómo se sentía y qué ocupaba.
Sí.
Yes.
And as you've already testified, Dr. Gutierrez speaks Spanish, correct?
Como ya testificó, la doctora Gutiérrez habla español.
Sí.
Yes.
And I believe you also testified that when you would bring Andrea to the clinic, she did not always see Dr. Gutierrez, correct?
Ya testificó que cuando llevaba a Andrea a la clínica, que no siempre era la doctora Gutiérrez que la atendía, ¿es verdad?
Sí, la atendía más casi ella, la doctora Gutiérrez.
It was Dr. Gutierrez, the one that saw her most, almost always.
And it sounds like from your prior testimony that you had experience using an interpreter at Hillsborough Pediatric Clinic before August of 2020.
Y parece por su testimonio anterior que usted sí había estado en una situación en que usaba intérprete ahí en la clínica de pediatría de Hillsborough antes de agosto de 2020.
Sí, lo recuerdo cuando estaba más chiquita mi hija.
Yes, I remember when my daughter was younger, yes.
So this makes me sick, and I'm going to tell you why. And just the expertise that these malpractice lawyers have. So one thing, my mom testified that she never heard ER from Kelsey Jo Moss. I'm not going to trust what Kelsey Jo Moss says. I'm going to trust what my mom says. The second part is this, I think if I didn't work in healthcare, specifically pediatrics, I wouldn't know exactly what they're doing. So after a certain age, for well checks, not sick visits, in an outpatient setting, the parent is asked to leave for part of the well check. So right there, in a sweet voice, Melissa is basically gaslighting my mom. So she's basically saying, and you remember that at age 10, that Andrea would sometimes be talking to Dr. Gutierrez, her PCP, primary care provider, and you would be outside the door. Because, again, they're trying to say that Andrea was at the age where she was coherent and my mom wasn't needing to be present. That's a motion that they'll keep saying. And so the way my mom answers yes, it's, the question is, do you remember that? But what's the context? The context is in a well check visit when there's no concern that the patient is sick, that pediatric patient is sick, the child. So that is just so misleading to the jury. And I was sitting there just angry how like the skill that they have just to really narrate something. And the second part is, they keep asking my mom, so you knew that you could have asked for an interpreter. They're going to need that for a motion that they're going to make later on. They needed her to say, yes, I knew. And again, it is not the patient's job to ask for an interpreter, just like it is not the patient's job to teach themselves to, make sure that they understand what the plan is. That is the healthcare team's job. And so, again, just the skill, and I'm sitting there listening to it. Obviously, I can't say anything. I don't want to be disruptive, but that's just so misleading. But that's how they try to portray it to the jury. Okay, so this is the last part here.
Ms. Osorio, this is the August 12th visit chart note from Hillsborough Pediatric Clinic that was written by Kelsey Jo Moss. And in the middle of the note, on the bottom, it says, discuss with family. You could highlight this, please. Discuss with family labs versus ED. Opted for labs. Do you recall any discussion of options with Kelsey Jo Moss? Like you were given options of what to do?
Objection, Your Honor, outside the scope of cross.
You did not ask about the emergency department on cross.
I didn't, Your Honor.
Okay, I don't remember every single question.
She asked about everything about the visit on August 12th. She asked what she was talking. She asked about everything regarding that visit.
That's true. The visit was talked about a lot in cross overruled.
So, Ms. Osorio, the question is, do you remember a discussion with Kelsey Jo Moss where you were given options, where she said, hey, you have an option. You can go to the labs, or you can go to the emergency department. Do you recall any discussion like that?
Señora Osorio, ¿recuerda usted cuando habló con Kelsey Jo Moss, si ella le dio algunas opciones, ella como si le dijo que tenía la opción o de ir al laboratorio o de ir a la sala de emergencias? ¿Recuerda usted alguna plática así?
Yo no me recuerdo que ella me mandó al laboratorio.
I just remember that she sent me to the lab.
Why did you go get Jasmine before you went to the lab?
¿Y por qué fue a recoger a Jasmine antes de ir al laboratorio?
Porque como yo andaba manejando y Andrea vomitaba, entonces yo necesitaba que alguien estuviera con ella pues para ayudarla.
Well, because I was driving and Andrea was vomiting, and so I needed someone who could be with her to help.
No further